Hello everyone, it's my pleasure to introduce MASS cohort, a multicenter, longitudinal, and prospective study of the role of microbiome in severe pneumonia and host susceptibility. The lung microbiome is closely linked to lung diseases like pneumonia, crucial for critically ill patients' survival. Pneumonia includes community-acquired, CAP, hospital-acquired, HAP, and ventilator-associated pneumonia, VAP. The complex mechanisms and individual differences in severe pneumonia necessitate further exploration of the lung microbiome's role. Establishing a large-scale ICU patient cohort is urgently needed. The previous MARS cohort set a paradigm for large-scale research on severe diseases. The team recruited over 2,000 sepsis patients from ICUs in the Netherlands and conducted multifaceted studies. As part of the MARS cohort, a 2020 study tried to predict clinical outcomes based on the lung microbiome of critically ill patients, but was limited by its small scale and single-center design. Another study retrospectively analyzed large amounts of single-time .16s sequencing data of respiratory samples, which couldn't deeply resolve the dynamic microbiome, although large-scale metagenomic analyses on induced sputum samples from COPD, bronchiectasis patients, and healthy individuals have been conducted. These samples are often contaminated by upper respiratory tract and oral microorganisms, failing to fully represent the lower respiratory tract. To address these gaps, we introduce the MASS cohort. We plan to longitudinally collect bronchoalveolar lavage fluid, or BAF, sputum, feces, and blood from 2,000 ICU patients with severe pneumonia, alongside detailed clinical data. Our goal is to uncover the dynamics of lung and gut microbiomes and their relationship to host susceptibility. MASS is a multicenter cohort involving 19 medical centers across 10 cities in 3 provinces. 14 centers in 7 cities of Zhejiang province form the ZJ cohort, while those in Henan and Shanxi provinces serve as non-ZJ cohorts for external validation. Upon enrollment, patients' basic information, medical history, and imaging data are documented. Simultaneously, BAF, sputum, stool, and blood samples are collected. When applicable, these samples will be collected longitudinally at 4, 7, 14, and 21 days after ICU admission. As of February 2024, the MASS cohort had enrolled 286 patients. Of these, 61% were from the ZJ cohort and 39% from the non-ZJ cohorts. The cohort consisted of 68% patients with CAP, 24% with HAP, and 5% with VAP. The cohort was predominantly male. 88% of the patients required invasive mechanical ventilation, or IMV. 48% of patients were transferred from the emergency department, 27% from internal medicine, 16% from other ICUs. 9% patients had extended ICU stays beyond 28 days. Outcomes as of April 1, 2024, included 54% patients discharged with improvements, 11% in-hospital deaths, 4% transfers to higher-level hospitals, and 2% in-hospital patients remaining. By the end of February 2024, the cohort had longitudinally amassed 502 BAF, 484 sputum, 386 stool, 282 whole blood, and 292 serum samples. We acknowledge the medical centers and research institutions participating in the MASS cohort. These medical centers contribute to patient recruitment, diagnosis, and biological sampling. These research institutions contribute to sample aliquoting, processing, and sequencing, as well as bioinformatic and experimental analyses. In summary, we constructed the MASS cohort, which comprises 2,000 ICU patients with severe pneumonia, sourced from 19 hospitals across 10 cities in 3 provinces. A wide array of samples, including BAF, sputum, feces, and blood, are longitudinally collected throughout patients' ICU stays. The cohort study seeks to uncover the dynamics of lung and gut microbiomes and their associations with severe pneumonia and host susceptibility, integrating deep metagenomics and transcriptomics with detailed clinical data.